to work for the VA institution, and at that time most black nurses who went to baccalaureate degree programs gravitated to the VA because the VA was the only health institution at that time that paid a different rate to the nurse who had attended a 3-year program versus somebody graduating with a degree. They rewarded you for the degree you had. They didn't look at the experience. I was lucky that once I transferred from the VA in New Jersey, and I was only there for 9 months, so during that 9 months, nobody ever said, I think you're a good nurse or anything. Again, I don't know what people thought about my nursing skills. I always got good evaluations, but nobody said, I think you're head nurse material. Those positions were occupied by people that didn't look like me. I don't even remember one black head nurse at the VA in New Jersey. But I wasn't looking either at that time. I just wanted to do my nursing. And I remember I was assigned to the neurological ward. That was hard work because those patients were frequently paraplegic, quadriplegic. It's like they'd come in on a stretcher and could only move their eyes. And I would say to this blonde, so how long has your father? He's not my father, he's my husband. It's like, whoops. Here this man is service connected, bringing lots of money in, and he's got this woman who is his wife. It's like, oh, after I said that a couple of times, I quickly learned to say, and what relation are you to the patient? Rather than assume that it's the father or whatever I said. It's like, oops, bad. That was possible because the VA here was changing from the role of the licensed vocational nurse, and they were upgrading downgrading what the LVN could do, and recognizing that the caliber of nursing care that the patient would get would be enhanced by having a registered nurse with a baccalaureate degree. And so I was able to come at the government's expense for any nurse who was willing to transfer to this VA. And that's another beauty of going to the VA. You have VA hospitals in every state throughout the United States. Once you pass the state boards, you could transfer they honored your license from whatever state you had reciprocity. So to transfer out here, I could have gone, and there were other nurses who also came and took advantage of that. What they offered you was to pay your fare one way, whatever way you chose, whatever mode of transportation, but you were obligated to stay 1 year. And that was hard work because they were short-staffed, and that was their way to attract you. But if you worked on a ward where you didn't have a permanent evening nurse, a permanent nurse on nights, that's their shift, you only relieved them, your schedule, you also worked a week, I think it was a week on nights, a week on months. That's a week on nights, a week on evenings. Or if you had permanent nurses on those 2 shifts, you just relieved them, you and all the other nurses who were on the day shift. That was very difficult because your body, 1 week to work that evening shift with 2 days off, or to work the night shift, your body couldn't adjust to the circadian rhythm that you needed to sleep well. And so that was hard. And but you did it. And that's why they were willing to bring you here, because they didn't have enough permanent nurses on those shifts. And so you had to rotate. A unit had 30 patients on it. Oh gosh, I don't remember. It must have been at least 3 RNs because you had the head nurse, and then you had 2 team leaders, and you had teams of other paraprofessionals under you on the team. So it was well staffed, but hard work, especially on the ward. I was on the medical ward first, and those patients had a lot of health issues, and a lot of treatments had to be done. A lot of medications were given. And so that's why I was divided, so that you had a team for this 15 patients and this 15 patients. And then you had orderlies under you, and those were the people who gave the bath, and you did the treatment and passed the medications. Only because somebody recommended me, a nurse who recognized that I had the ability, and it was because of the relationship I had with the people who were under me. Mm-hmm. Oh, in 9 months, I was promoted once I got here. And again, it was because that head nurse saw something in me. I didn't even know she was watching me, but obviously she was, and she was fair and honest. And I guess I never recognized what that meant, because I never went back to say thank you for doing that. Yeah, that was nice. Once I became a head nurse, that removes you from the bedside, because you're supervising and you're making the schedule. And I didn't pay attention. First of all, the baccalaureate program doesn't prepare you to be a head nurse, and that's a different skill than being a team leader. I had to figure that out. So once I became a head nurse, then you got to make the schedule, make sure that you have a balanced staff to do all the things. I didn't pay attention to how people spell their name, and I might have, anyway, I'd misspelled the name on the schedule. You're doing this by hand. Didn't pay attention to who got the last weekend off and who gets that. They quickly let you know, Miss Roberts, first of all, my name is spelled blah, blah, blah. It's like, oh, okay. So I got that down. I haven't had a weekend off, and so. They're looking at every little detail. And finally, I said, you know what? I don't have to make the schedule. You guys can make your own schedule. You get together, make sure we have this many RNs, make sure we have this, whatever the ratio was. When I let them do that, that was one. They thought I could walk on water then. I don't need to you make it. You guys argue and figure it out. I don't need to do. They loved me. As a matter of fact, I had one lady say to me, you know what, Miss Roberts, if you told me to move this building, even though I know I can't, I would try just for you. It's like, oh, that is so sweet of you to say that. I left in 1965. I actually came out here in 63, in 65, and I left. Well, I took a medical leave. You could take a leave. I actually went back there to do the research when I wrote my thesis. But once I became a head nurse, I was given the worst ward in the hospital and didn't know it, and that was the alcoholic ward. And I say it was the worst because those patients were very, very, very sick. I have seen patients with ascites from alcohol, cirrhosis of the liver, so sick that the ascites just ruptured. All this fluid is on, oh my God, so sick. Patients coming in with maggots on them where they've been in the gutter. I mean, really, really sick. Ulcers on their feet, just because they were so sick. And it was because we didn't understand substance abuse. They would have to go to the AA meetings, which were held right there on the grounds. They would have to go. But they weren't treating what caused the alcoholism. They saw it as a psychological phenomenon. I think it's much more than that. I think there's a genetic component there. I've seen it in generations in families, alcoholism. It's complex, it's multifaceted, it's not just one thing. And at that time, in the 60s, we didn't know that. We've learned a lot since then. But that wasn't for me. And once I realized that, it's like, I'm out of here. I'm out of here.